For the monthly trach tube changes, this is the equipment that we need. It's a clean technique. We need clean gloves. We want to check that the new trach tube is actually working. So we inflate the balloon, we immerse the trach in sterile saline, and we see if there are any bubbles coming out of the tube. If we don't see any bubbles, it means the balloon is in great condition. Then we can leave it inflated for a few minutes to confirm that it's going to hold the pressure. Once we know that the tube is working, we want to deflate the balloon and we prepare for reinsertion of new tube. To remove the old tube, we have to make sure that we suction all the secretions above the cuff before we deflate the balloon. So we will use the junker to suction oral secretions. We go as back as we can. Once tube is completely deflated, we proceed to remove the trach tube, introduce the new tube. After lubricating the tip of the trach tube, we go from one side down into the trachea. Once the trach tube is in, we remove the obturator, we introduce the inner cannula, lock the inner cannula. We can put the patient back on the ventilator and we will reinflate the balloon. Once the tube is inflated and the patient is back on the ventilator, we can readjust the tracheostomy tubes.